I'm Dr. Amy, and we're here to talk a little bit about another success story on its way with Snickerdoodle. Snickerdoodle is a cute little paint mare, and she wants to be the sweetest horse ever, except that she tends to be a little bit irritable, and she's really sore sometimes, and when you touch her in certain places, you can see that she doesn't like it too well. If you look at her ears and her eyes, she says, "Don't touch my tummy." She has been, when she came to the barn here, she was a little underweight. She had been sort of abused by the horses in the pasture where she was living. She was the mare, and everybody else thought they were the stallion, and so she was pretty abused that way. That's part of where her stress comes from. But we've also identified that she had some GI tract irritation. So we've started her on a program to buffer her GI tract. We've changed her diet to include a better protein and better fat source. And what we're seeing this winter, this is her first winter after being on that, and she's grown new hair and recently had a body clip. And what we see here underneath that body clip is some darker areas of hair. If you look right here and then back here, that darker hair is an indication of changes in protein. Hair is an excretion source. Hair, like other excretory products in the body, carries with it some of the minerals or chemistry that was internal to the system, and as it builds a hair molecule out of the proteins that are there, can also form color. The cell itself will produce the color that it's going to be. And what we're seeing here on Snickerdoodle is that some of her cells are showing us a different color because the melanin levels in them have changed, because we've begun to change the GI tract permeability that she has. And so what she's teaching us as she goes through this transformation and becomes healthier and builds muscle, she's starting to build muscle in the right direction so that she's using her hind end better. As she does all this, on the outside, her hair is letting us know that some of the vitamins and minerals in her diet are helping her get rid of some of the elements that are not the best for her to have in her system. As she goes through this color change, we'll monitor it and we'll see what color she actually ends up being. Although she looks to be a little bit of a palomino paint, she may actually end up being a much darker horse by the time all is said and done. She's been adjusted a few times, as I know, but she's also been used pretty routinely for lessons and for shows, and seems to be benefiting from that quite a bit. She's had some teeth work done so that she moves better because of her dental problems, and that's why she's able to build nice muscle through her head and neck. And I'm going to ask Dr. O to ask her to do some motion so that we can see how well that head and neck are moving, because that can be really important in terms of maintaining that GI tract buffering system and less irritability. She twists just a little bit when she comes around to the side. So she's...
It's been a month and a half since your last adjustment.
It's been a month and a half since her last chiropractic adjustment, so she still has a little bit to go. She's not going to be no horses ever.
Right in here in her back.
She's pretty stiff through the back, through the lumbars. And keep in mind that when we have GI tract irritation, sensory input to the brain also sends out motor input to the muscles.
Right, so as muscle.
So we can end up with muscle spasm in the skeletal muscle because of sensory input from smooth muscle, which is the muscle that surrounds the GI tract. So one way to help reduce some of that is chiropractic adjustments. So we're going to take a minute and we're going to adjust her real quick, and when we come back we'll look at how some of that motion has improved. We've taken a brief break so that we could adjust Snickerdoodle and get her moving a little bit better. Dr. O is going to demonstrate how she can move now. She was had a little bit of discomfort while we were adjusting her because of the muscle spasm. But keep in mind that, you know, these horses who have had GI tract irritation are probably having a lot of trouble moving anyway because they can't uptake their minerals. They shouldn't, oftentimes in their hair follicles and through their GI tract, and they won't be able to use them in their body systems like they should. She also had quite a bit of dental work when we started first working with her, and that was very, very important. There was just no way that she could use her head and neck the way she needed to based on the way that those teeth were sitting in her mouth. But now that we've fixed those teeth, it's definitely helped a lot. Now you can see she's not nearly as uncomfortable when Dr. O gets her to bounce a little bit in the hind end, and she bounces better. She's listening to him, she's paying attention because she expects it to hurt. But she's not painful, she's not pinning her ears and squinting her eyes and acting like she's about ready to get him, because it doesn't hurt quite as much. She's still a little sore under her tummy, and that still comes from that GI tract that we continue to treat. So Snickerdoodle has had a long therapy treatment so far. She's coming around really well, and we're looking forward to when she gets back to being a little bit more like a normal horse. We can't wait to see what color she's going to be.
Long therapy. She's only been here for 3 months.
That's quite a while.
Yeah.
You know, but it's not unusual for it to sometimes take 6 months, a year, depends on the horse. So if you're planning to harmonize your horse's health, don't expect it to be quick, don't expect it to be short, expect that it's going to take some time. If you try to make a horse out of cement, it takes a long time to put the right minerals and vitamins back in.